All right, Saagar, what are you looking at?
Well, everyone, the media and the public health establishment are at it again. So I feel compelled to revisit the topic of monkeypox, which on Friday was officially declared a public health emergency by the United States and the CDC, opening up billions of dollars of funding to combat the disease and heightening the debate as how cases spread. How do we contain it? Now, before I start, I think it's important to review the facts as they are. To be clear, once again, monkeypox is a smallpox variant emanating from Africa. It induces pretty severe illness in those that get it. From what we have seen so far in the West, it is fatal in very rare cases, but it is unpleasant enough and viral enough, dangerous to those with worse comorbidities, that we should do everything in our power in order to contain it. All current evidence from the study after study in the West confirms the same transmission vector. The vast majority of monkeypox cases are occurring amongst men who have sex with other men. I say this with no judgment. It is simply a fact. This is mere fact, and transmission vector has of course now ignited a massive debate amongst the public health establishment, who find themselves so captured by woke ideology, they seem unable to actually just admit the truth, and are igniting mass panic. They are also risking gay men's lives, and beclowning themselves even more after COVID, which many did not even think is possible. Best on display is in the debates happening right now amongst public health officials at the CDC and in major American communities that have large gay populations, where they are having a vicious debate whether to recommend to gay men to limit their number of sexual partners in the time being. Now, this is peculiar for a number of reasons. Number one is, why should it be a debate literally at all? As we know, transmission overwhelmingly occurs between gay men. Transmission also appears to be concentrated in clusters traced back to group sex events. In such a case, the solution is clear, as they literally admit, quote, public health authorities typically emphasize safer sex over abstinence to prevent the spread of diseases that happen through intimate contact. Standard operating procedure. Any disease that spreads through sex. You tell the public how it transmits, you issue guidance. If people want to heed that advice, that's on them. At least they have the information. But somehow, because monkeypox spreads amongst gay men, it's different, according to these folks. According to the California state officials who are actually heading up monkeypox response, quote, if people want to have sex, they're going to have sex. He adds that he knows people who normally go to sex parties who will not. People will make their own decisions about their risk levels. Now, this is interesting, is it not? This official is saying that with monkeypox, it's okay to admit that people will assess their own risk levels and make their own decisions. The city of San Francisco, for example, declined to shut down a gay fetish festival in the city where they suspected group sex would occur. Instead, they disseminated information to attendees on how monkeypox spreads. To be clear, I support this messaging and this approach. I think people are free to put themselves at this risk if they want to, as long as they know what the risks are and the information. But, and this is the biggest but, compare this to COVID. The public health establishment asked all Americans to undertake overwhelming lifestyle interventions, pulling kids out of school, staying home, shutting down our economy. We refused to admit for a single second it was okay to let people assess their own risk levels, and instead demand that Americans wear masks for nearly a year, even after they got a vaccine. So consider how much you were asked to do to prevent the spread of COVID. But now, apparently, when a disease is overwhelmingly affected a so-called marginalized group, then we all have to get very sensitive about language and have to be mindful of their advice. Consider this. At the height of the pandemic in June of 2020, the New York City Department of Health put out a guidance for its millions of residents to practice safer sex. That included wearing a mask, not kissing, and not engaging in any intimate relationships with people. They literally had no problem advocating for both safe sex and abstinence in the case of a respiratory disease. They didn't even think twice about it. But this disease, which overwhelmingly spreads through sexual transmission, is not getting the same treatment. All anyone wants in this country is just to be treated equally. Gay men are adults. Like all adults, they deserve to be treated the same, without some ridiculous notion that by acknowledging basic facts around this disease, that it will somehow turn the entire US population homophobic overnight. To see the contrasts in real time is just stunning. It gives zero confidence that the public health establishment can ever, and I really mean ever, be trusted again in our current lifetime. Be watchful of how they are handling themselves as monkeypox continues to spread, because the more they set the standard that different subgroups of the population are somehow treated with more sensitivity or care than other different standards, what we can tell other people to do and what not, the more they're going to shred credibility in the future. And I can be sure of this. The next time they tell us what to do, by default, it's just going to be no, or prove it to me, or I don't believe you. And that's just not a good place to be as a country. I just think it's incredibly hypocritical, Crystal, the way that they're handling all of it.
Cable news is ripping us apart, dividing the country, making it impossible to function as a society, and making it impossible to know just what is true and what is false. But the good news is they are failing and they know it.
That is why we're building something new, a new mainstream, a healthier one, something more trustworthy, something that we are going to need in one of the most pivotal times in American history. We are building up here for the midterms, for the upcoming presidential election, but we need your help. So if you can help us out by becoming a premium member today at breakingpoints.com, we're trying to change America for the better and the entire world.
So what are you waiting for, guys? Go to breakingpoints.com and sign up and help us build a new mainstream.